Welcome into Fitness Fanatics on 93.7 The Ticket and theticketfm.com. Now here are your hosts, Jeff and Nicole Essig.
All right, welcome back to the Fitness Fanatics. Well, you guys, we've been on the air for almost 3 years, and we talk a lot about, obviously, fitness and wellness and how to be healthy. And an important factor besides just nutrition and working out every day, a critical factor in being healthy and your well-being is getting good quality sleep, which is something we've talked about over the last few years. But we decided to call in the experts.
We did. Well, I thought of it because Mondays I do a post in our closed group for our gym, and people were posting like their goals for the week. And a lot of people have sleep goals, but I don't think they have any idea like what that means. Like you can't just say my goal is to get, 8 hours of sleep, but like it's like that meme or whatever. Like I really need to get 8 hours of sleep. And they're like, well, have you tried going to sleep 8 hours before you need to get up? And they're like, no, I would not. No. What? Yeah. I know. So I thought I know we have a lot of members that is a goal of theirs, but I'm like, but do you have any tools or ideas of what that means? And so then I thought we need to get an expert in here to answer these questions. And
so let's introduce our guests. Yes. So the first guest, we have two guests. They're both from Bryan Hospital. First guest is Dr. Kevin. So Kevin, if you just want to tell us and the listeners kind of what you do at Bryan when it comes to sleep, that would be awesome. We'll start with you.
Yeah, sure. So I'm board certified in sleep medicine, and I serve as the medical director for the Bryan Sleep Lab, and as well as some other sleep facilities. And I've been doing sleep for, over 20 years now.
You were into sleep before sleep was cool, right?
That is true. Yeah. That is true. But after
we never had to think about it. Yeah. Before. Yeah. Awesome.
All right. And our other guest is Cindy Dahl. So Cindy, let us know what your role is at Bryan when it comes to sleep.
Well, good morning. I first started out as a respiratory therapist. That's my first passion is I went into respiratory therapy. And then when I was at Bryan Memorial, we decided to start a sleep lab. And I like to sleep. And so I thought, this is very appropriate for me. So I have actually been at Bryan for 38 years and actually in the sleep center for 36 of those years.
Oh, awesome.
And so I've gone up through all the channels. I was a sleep technologist to the coordinator to the assistant manager. And now just recently in last September, I'm promoted to the manager role of sleep, EEG, and pulmonary diagnostics at Bryan.
That's just cool. So I didn't even know any of this stuff existed.
For so long.
I know. Because the best moment of the day for me is going to bed. Yeah. Like if you get to bed, man, you survive the day.
I know.
It's like
I remember
so nice.
so we have two kids and our son is 18. And I remember when he was a baby, to get him to take a nap, I used to be like, yay, sleep, or whatever, like make it exciting. And then I will still say that sometimes to myself at night, like, yay, sleep. But I really didn't realize it was like a thing for this. I mean, it's been a thing always because we sleep. But a lot of times when it comes to like health and wellness, I always think of it in terms of like, especially when you're kind of trying to discern between like things that are hoaxes or someone's trying to sell you something. I always think like, is this something that my grandmother worried about? Because there's so many things people worry about, like in the health and wellness space that are like, listen, my grandma did not worry about this. I just saw one. People are worrying about if they need to switch their spatula out while they're cooking their meat because it starts raw and then it ends cooked. And they're like, do I need to switch out a spatula? And I'm like, listen, we never would have survived as a species.
Probably not.
Like my grandma never worried about that and we were all fine. Yeah. But I think with sleep, it's so different because the world is so different now. And so it is surprising to me that has been like a focus of study for that long.
Mm-hmm.
So
what exactly do you guys do at the sleep lab at Bryan?
Well, we do lots of sleep studies. And of course of time, that has really altered from doing the majority of our sleep studies in lab, where we would bring people to sleep in the sleep center during the night, where we're doing a lot of now what's called home sleep studies. And it's sleep is very regulated by insurance. So the majority of all sleep studies need to be insurance authorized. And so patients that get to have in lab or get to have home sleep studies are the ones that have snoring, daytime sleepiness, witnessed apnea, gasping, choking, that type of thing. If you're just a snore, but you're not sleepy, that type of thing, that's generally you're not going to get, you just can't call your doctor and say, hey, I think I need to have a sleep study. You have to have those other symptoms that go along with it. Patients that have congestive heart failure, chronic lung disease, anything neuromuscular like muscular dystrophy, seizures, anything like that, stroke, those are the ones that have more of those coexisting, those other health conditions that home sleep studies are not for them. They need to have that in-lab study. So to differentiate between the two, the home sleep studies, the patients just come in during the day or in the evening, and we educate them on how to take the equipment, set them up on themselves at home at night or during the day, wherever they sleep. If they're night shift workers, they'll do the study on themselves at night in their own home, in their own bed, and then they bring it back to us and we download it, score it, that type of thing. For in-lab studies, they come in and they actually spend whenever they're sleeping, day or night, and we hook them up to a lot of different things. We hook them up to EEG, so we're able to see when they're awake and they're asleep, respiratory belts to tell when they're breathing, oxygen level, heart rate, leg movements, that kind of thing. So they get a lot of stuff hooked up, but remember, these are the patients that are falling asleep driving, falling asleep at work. They sit down, they fall asleep. So, that's the number one question is, will I be able to sleep when I come into the sleep center? But if they're falling asleep anytime, anywhere, they should not have a problem.
Right. If you're asking that question, you probably aren't the one needing that type of in-depth sleep study. That makes sense, because that's immediately what I think of. Like, man, it's hard for me to sleep outside of my nice little adjustable bed that I can sleep with my head elevated. And,
yes, we got a Dream Cloud adjustable mattress. So Nicole sleeps with, and we have a king size bed, but they're two separate mattresses. So I can't imagine if we would have bought just a king size.
You would be sleeping with your head elevated.
Yeah, she sleeps with her head elevated, her feet elevated.
I don't always have my feet elevated.
And I sleep just as flat as can be.
We could have just gotten one, because you don't really use yours that much. But
yes. Yeah.
I know.
That's crazy.
Yeah. So that would be hard for me. But then I'm glad you mentioned that when you're needing a sleep study like that, that makes sense, that you're tired anyway. You just need it, so that is interesting.
All right. So one of the questions I have, I don't know if we can get into this now, is just like what we see with our gym members is sleep apnea, like how different that's changed over the last 10, 15 years. Because I always thought like sleep apnea, if you were, out of shape, overweight, you would need that. But we have some of our members that have come into Farrell's with sleep apnea, need to use the machine to sleep, and then lost a bunch of weight, but still need the machine. So I guess I'm kind of confused on sleep apnea. So kind of go into that, like what's the
clinical?
Whatever.
Yeah.
Yes.
Yeah. So sleep apnea is just the phenomena where you stop breathing, or more likely even just underbreathe, and that causes oxygen levels to drop and sleep disruption. And it's one of the more common conditions and very under-recognized. And so I think you're hearing more about it because there's more attention paid to it because of the role it plays in our overall health.
Right.
And to your point, obesity, male gender, big necks, all that are huge predictors, especially when you're younger, under the age of 45. But there's a lot of sleep disordered breathing, sleep apnea, that occurs in, people that are of normal, kind of anthropometric features that are probably related, complicated upper airway and control of breathing type things. And so to Cindy's point regarding sleep studies, and one of the main reasons we do them is for sleep disordered breathing. That's the predominant reason. And so if you just go off the, kind of textbook looking person, man, overweight, big neck, you're going to miss a lot of people that have sleep apnea. And then, like Cindy said, snoring is really common, and snoring in and of itself, may not be a major health issue. And so not everybody that snores needs a sleep study. But if you're having those kind of symptoms of tiredness, waking up unrefreshed, somebody's hearing you snore loudly and then stop and gasp for breath and all those kind of things, then that's when evaluation for sleep apnea is really necessary.
We're kind of blessed because we're not snorers.
Mm-mm.
Every now and then,
Yeah, just every once in a while.
I will snore, and Nicole,
Elbow.
Hey, quiet. And then I'm like very conscious, like the rest of the night. Like for me, I think it's just if I get my throat's dry or something, I'll have a little. I don't really want to make the sound on the radio, but
we all know what snoring sounds like.
All right, so we're talking all things sleep here. So Nicole, where do we want to go to kind of introduce to this next subject?
Well, I think one of the things I want to talk about is how much sleep do we need? I know that's like a range for everybody, but like, how do we know if we're in our range? Does that make sense? Like, how do you know that? Because I feel like I am a person that needs 6.5 to 7 hours of sleep. That's kind of where, and for me, we were talking off air. I don't really usually have a problem falling asleep, but I do. There's a certain point once I'm up, I can't get back to sleep. So sometimes I'm up at like 2 and I'll lay there for maybe 10 minutes. But if I'm not falling back asleep or I'm not tired, then I just get up and then I'm up. So how do we know? How do we find out how much sleep we need?
Yeah, it's always a great question. I do think it's there isn't a one size fits all. This saying of 8 hours of sleep, kind of comes from surveys and, where the Gaussian curve was. And so, that's kind of gets thrown out there. I think what we know is, in adulthood, it's somewhere between, 6 and 9 hours, maybe. So people who get consistently less than, 6 hours of sleep, that's when we see some of the problems that can occur from lack of sleep.
What are some of those problems?
Yeah. So, I mean, there's tons of evolving data on what we call sleep restriction or sleep deficiency. And again, 5 to 6 hours is where that cut seems to happen. And so in patients, individuals who get consistently less than that, and I'm not talking, there's impacts, even 1 or 2 nights of that, but this would, be a little bit more long-term. Boy, there's, data for higher risk of dementia, higher risk of weight gain, higher risk of hypertension, cardiovascular disease. I mean, diabetes. I mean, there's, lots of different things that have been associated with less sleep. So those are the big things, that would kind of be, long-term effects, but even short-term, performance type things when you're sleep restricted. And I'm talking, athletic and cognitive or academic performance, because when you sleep restrict like that, then, there's data to show, there's higher risk of sports injuries, slower recovery post exercise or performance, and also altered, learning and retention of learning. So because you're cutting out, kind of what our brain needs to and body needs to cycle through all those things. So I think on the flip side, one thing that develops when you do focus on sleep, and so it's a double-edged sword, there are people who get, so like what I'm talking about, sleep restriction or sleep deficiency, is either intentional, schedule weight related things, or maybe it's medical, like what we were talking about, sleep apnea or those kind of things. But there is always one of the challenging groups of people are people get sleep anxiety.
Yeah.
So they're so focused, I've got to get 8 hours of sleep, and it generates truly this sleep anxiety. And now with wearables and all these things, they're fixated and infatuated with it, and it's really counterproductive when I'm seeing them in sleep clinic, because what you're trying to do is make them, like not worry so much about sleep.
Yeah.
Just let it happen. Don't focus on it so much. So so to answer your question, as adults, it's, probably 6 to 9 hours. And younger, adolescents, probably need 10 hours, 8 to 10 hours. And, you can kind of go down go up by 2 hours as you drop age groups.
Mhm.
So,
Yeah, that's the thing with like me telling myself 6.5 hours or 6.5, 7 hours. Is that just because that's how I've trained my brain or my body? Or is it, I guess I just don't know. It's tough because I'd have to go to bed even earlier, which I mean, 7 hours is like, for me, is like my goal. And I
Well, that's
have,
8 o'clock.
I know.
We're usually in bed by 8.
Yeah, but again, so I wear an Aura ring, so I do have the sleep wearable data, and I do sometimes get sleep anxiety, not to fall asleep, but if I wake up and I like have a low sleep score or my readiness score is low, I do feel it in the morning. So then it's like, for me, it does help me make it a priority. But one of the things that, and you can tell us how accurate something like that would be, but like one of the things it tracks is your latency. It tracks how quickly I fall asleep. And sometimes it'll ding me if I fall asleep too fast because I was overly tired, or it'll ding me if it takes me too long to fall asleep. So it's like, have I just trained myself, or if you're wondering, what's the amount of time that you would have to try to get more sleep to find out if you're getting benefits from it? Does that make sense?
yeah.
How long do you think that would?
Yeah, I would say, that'd be one of those things where I'd say at least, a week and maybe even a month.
Okay.
And to your point, I mean, if you're getting 6.5 hours of sleep and your, overall functional status, performance, how you feel, again, there's going to be variability, but that is probably, adequate for you.
Mm-hmm.
And more sleep, in certain situations can be better, but again, in what's happening, the challenge that occurs is when people wake up, like what you're describing it, you said 2 a.m.
Mm-hmm. Mm-hmm.
You've already had a block of sleep, so you've dissipated what we call the sleep drive. And then again, the circadian rhythm is a 24-hour type thing, so around that time there's actually a little bit of elevation in our circadian, and that was, when our ancestors were, that would be the time when you might need to engage quickly to survive. And so it's probably evolutionarily why it's that way. And so you're just, something's waking you up, and you just, it's going to be hard for you to get back to sleep because it's your milieu isn't in a place where it's going to be conducive to falling back asleep very easily.
So if there's other people, because I know there's some people who struggle to fall asleep, some people that struggle to stay asleep. In my case, when I struggle to stay asleep, what would be the best strategy then? Should I try to, we get up at 3:10 is when our alarm is set. So I'll wake up, and it's not always. Sometimes I'll wake up and I'll be able to go back to sleep. But when I do that, should I try to still sleep? Should I lay there and just try to go to sleep, or should I just get up?
I think it's good to try to go back to sleep.
I usually give myself like 10, 15 minutes. Then I start getting mad. So I'm not
right.
Gonna
And then that's, you don't want to do that.
Right. I know.
So, we usually tell people with insomnia, whether it's initial sleep onset or sleep maintenance, if you're not getting to sleep, we usually say somewhere around that, 20 to 30 minute mark, it is better to get up. Now, again, you don't have much additional time to sleep because of what time you have to get up, but we tell people that doesn't mean get up and get on your phone or turn on the TV. Yeah. Try to.
I get out of bed. I don't get on. I'm at least sitting on the couch, but I do get on my phone.
Yeah. So we recommend against that, get out of the room and then wait for kind of that sleepiness feeling to come back.
Yeah.
And then go back, engage in the bed.
I did do that last week. I don't think you knew, Jeff, but I woke up at like 1:30 because our son went out into the garage and slammed the door coming back in, and it woke me up. And I was up, and I did do that. I went upstairs and I did not get on my phone because there was enough time still for me to go back to sleep. And so I was up for about, 30 minutes. And then I went back down and laid back down because I still had an hour to sleep. But if I get up at 2 and I'm giving myself 20 minutes, 30 minutes, and then I only have 30 minutes to sleep, then I'm probably going to wake up more tired. I feel like, I don't know, but
one of the most fascinating moments every night is when you have to get up and go to the bathroom.
Fascinating.
Well, it's fascinating because the moment, and you guys have this too, right? We get up and go to the bathroom in the middle of the night. What time is it? I'm like,
Right.
okay, I'm getting ready to
Please.
hit my phone
Yeah.
to see what time is it. Sometimes it's like 2:50.
Yeah. You're like
20
"Dang it."
minutes for my alarm.
Yeah.
Other times it's like 1.
Yeah.
Or I know I'm in a lot of trouble if it's like 11.
Right.
Like I have 4 more. Oh my gosh. And it's just like sometimes it's hard to you toss and turn, and it's just really, but it's interesting how our brains are just like I'm 20 minutes away from my alarm.
Yeah.
Or
And
when
it
you have
just
to get
held
up, go to
out.
the bathroom. But
I know.
it's just interesting. So what are some good tricks and tips to get quality sleep?
Mm-hmm.
No TV in the bedroom.
Oh, we have a TV in our room. I knew you were going to say that.
Yeah.
And I'm terrible about that too, because
No.
I like to watch the news before I go to sleep.
That's
And
terrible. We at
I-
least watch funny things.
No,
We
and I just-
watch-
well,
yeah, I couldn't.
Because I like to watch the news. It's not watching the news. I'm more of the weather person
Yeah.
Sure.
because I live an hour from Lincoln.
Right.
And so my drive in, I'm always very worried about that. If
Mhm.
it's going to be snowing, that kind of thing. So I always, try to limit the TV
Mhm.
because I know that the TV is a light producer. And when your eyeballs, when you get that light, it keeps telling you that it's okay to be awake.
Yeah.
So you need that darkness. That's why you need to decrease your screen time.
Mhm.
So many, so long before you go to bed, that type of thing. I am a huge sound machine,
Oh, yeah, yeah,
or
yes.
something
Okay.
to just that noise to take away, because I live in a small town. We have barking dogs. I have neighbors that work 24/7. They're up at night,
Yeah.
that kind of thing. So I have a fan running that points towards my window. So I just have that
Yeah.
white noise
Yeah.
just to help block out all that
So
stuff.
that's okay.
Yes.
Okay.
Oh, we have. I don't
Phew.
know how people sleep
Our
without.
son sleeps with
fan.
nothing. He just silence. I don't know.
It's
Everybody, yeah. I sleep with nothing.
You
Oh my
do?
gosh.
Yeah,
Oh
I do,
my-
yeah.
You just
Yeah.
go to sleep
I
in
do.
the silence.
I do.
And
I do.
wake up in the silence.
I do. I do.
You know?
I do.
I don't think I could shut my brain off if I had
Like,
to sleep in
we
silence.
have a dehumidifier that runs in the basement. It's
because
you
our
know,
bedrooms in the
pretty
basement.
loud. Like if it were up to me, I'd have those giant fans that they got that are just like 5 feet
Industrial.
wide.
Yeah.
And that's what I would have when I slept if I could have one in the basement. But if that turns off,
In the middle of the night.
I am up
Yeah.
in just 2 seconds. Empty the dehumidifier, put it back in,
Yeah.
and then go back to bed. So that's crazy.
That is crazy.
Well, I
Harrison,
used-
what do you do?
Oh, go ahead.
I
Sorry.
use just white noise.
Okay.
That's the way I do it as
Yeah.
well. Just rain noise
Yep,
or something.
something.
Mm.
I used to have nothing either. I mean,
Yeah.
I used to have no noise, but my neighbors had a dog that they let out at 1:00 in the
Ugh.
morning.
Mm-hmm.
And this dog would bark and it would wake me up. And by waking me up, I would get into that situation with you. And
Yeah.
then my brain then just would not shut off. I was angry and just like, get upset about this dog and it ruined my day. So by putting the fan on, that has
Yeah.
helped tremendously.
I feel like we didn't always have something running.
Always.
Are you sure? In our very first apartment, we had a fan on.
Always.
Okay.
I've had a fan since I was a kid,
Oh, I didn't.
just in my room. It's just
But our kids did. They had white noise. So no TV, but that's more because of the light. What about like music? Is music okay to fall asleep
Yeah. I mean,
or no?
it would just depend. I think, yeah, I mean, you probably wouldn't want to necessarily have something that's high intensity,
like
Sure.
Metallica.
Metallica,
No Metallica.
or rap or something. like that.
Yeah.
But especially calming classical music. I think one of the big things, and you guys have already kind of elucidated with your schedule, is just having a schedule. I mean,
Yeah.
one of the worst things patients can or people can do with sleep is, and again, sometimes life requires
Yeah.
this, but in general, to have this is going to be my bedtime and this is going to be my awakening time, or my out of bed time, and understanding that in general, we like, at least roughly 75-80% what we call efficiency so the time in bed,
Mhm.
is roughly 75-80% or more sleep.
Mhm.
If you're less than that, then you're spending, maybe too much time in bed. So again, patients who think like, oh, I need to get 6 hours of sleep, so I got to spend 11 hours in bed because that's a really bad sleep efficiency. It's one of the first things we try to get them to do. And then I think the TV is partially because of light and partially it's because of engaging the brain again.
Mhm.
Mhm.
That
And
was my
then
other question. Like, what if you wear a sleep mask? So you're
just
not
have a-
getting the light,
yeah,
but it's still
it's
not
still
good.
yeah,
Dang it.
because subconsciously
I don't know if we're willing to give that
yeah.
up.
um, and then
He's like, I've heard
yeah.
this.
I know,
Yeah,
right?
yeah,
You know what he
exactly.
should tell you,
That
Nicole?
does not make you
Yeah.
special.
You're not
I
special.
know. I know. I know.
You're
Yeah.
normal.
I know.
Yeah,
Yeah.
yeah.
We
But
know
again,
that. We
like I
know
always
that.
tell people, if it's working for you and you feel good,
Yeah.
it maybe in your case it's not disrupting you, but in general we don't recommend it.
Yeah.
And then the devices, any of the devices, the computers, the phones, one of the big, and this, when you talk about different kind of things, are they legitimate or not?
Yeah.
Our phones emit and computers emit a blue light,
Mhm.
and blue light is one of the most potent, melatonin suppressors. And so
Hmm.
that is one of the big reasons why cutting it out. And that there's value, there can be value in if it's something you have to do in the late evening, having some kind of blue light blocker, whether
Okay.
it's the
That
glasses
was a
or
good
the thing.
question.
Yeah.
Yeah. If those are help or do
They
anything.
can,
Okay.
again, because of that blue light spectrum.
Mhm.
But again, not everybody needs them. I mean, it just depends on, but trying to cut that out and avoid, and again, I'm guilty of this too, lay down to go to sleep and
I
all right,
know.
I'll look at my last final
I
emails
know.
and texts. So,
Yeah.
Yeah.
This is one of those things. It's a goal that I have. Then I forget that it's a goal until I've broken it, is to have my phone to have a bedtime that's like earlier than my bedtime. And I think every day I'm like, okay, this is it. Or every week, I'm going to come home from the gym because we go back at night. So I'm going to come home and we keep our phones by our bed, but plug it in and not be on my phone when I get home. And then I forget until the next morning
Shoot.
or
I meant to
until
do
I
that.
go to bed, but I think that if I think of it as like, okay, it's my phone's bedtime, that would help. But then I forget. And then I'm on my phone right before I go to bed or right when I wake up.
Have you seen any correlation of like more people sleeping worse with these, like since these became a thing?
Mhm. Oh yeah, definitely. Yeah,
Mhm.
there's good data that with the evolution of mobile, cell phones that are like the current
Yeah.
platforms. Because people didn't always take their laptop into the bedroom, and the old school flip phones, didn't
Mhm.
have all those features, and so yeah, it's a huge, and especially for again the younger generation, the adolescents, and so forth. It's a huge detriment to the focus on sleep.
Mhm.
So,
I will tell you, our daughter's 22, and she is the most aware and very conscious of her sleep hygiene, which is something that we never even heard of ever. So there are parts of the younger generation, at least, that are focusing on it because
Mhm.
she's very strict about it. Her kind of bedtime, and then sometimes she will stay up past her bedtime, and she also works out. She works out at 4 a.m. She's an instructor for us, but there's a lot of times that she will forego her morning workout because she didn't get to bed early enough. So she's actually really good about it. So that
Yeah.
gives me a little bit of hope.
oh yeah, definitely.
Yeah.
No,
No.
I think because to your guys' point, sleep has always been important, but there was, like the old saying, I'll sleep when I'm dead. And, even coaches that would do 2-a-days and
Mhm.
Yep.
you'd practice and get up real early. And I think, if you look at even the International Olympic Committee, the NCAA, I mean, they've all put stuff out there on sleep and the importance of it. And so I think, the younger generation, to your point, hopefully, as much as we want them to put on nutrition and exercise, sleep is part of that triad.
Mhm.
And so having that as part of your, priority and having an approach to it that is best for you to make sure it's being taken care of is going to pay dividends, for their long-term health,
Mhm.
physically and mentally. So,
Well,
Yeah.
speaking of nutrition, we did in January, we did Whole 30, which is, no sugar, no dairy. Basically, you're just eating
Whole Foods.
Whole Foods.
The 30-day elimination
Yeah.
diet. You're nodding your head, so I'm sure you've heard of it.
Yeah.
Yeah.
And
Yeah.
Nicole with her Aura Ring, like her statistics of her sleep score, her readiness score, her What was the one that just shot onto
My
exceptional?
resiliency. So that's like, because the Aura Ring tracks your heart rate variability, your oxygen levels when you sleep. It tracks all that stuff. Well, and then it gives you a resiliency score. And over, like, it went from strong, like it was already okay. And you could watch it over the 30 days, just steadily incline and up to exceptional. And it stayed there.
Mm.
And then Aura Ring gives you a readiness and a sleep score. And I went back in November and December. My readiness was always terrible. Like, because you get a crown if you get above 85.
This is fixation.
Right. Yeah.
on crowns.
I know.
Yes.
You
Yes.
get a crown if you're above 85 on your sleep score. I went back. I didn't know it was as bad as it was. In December, I only got 3 crowns for readiness and like 7 for sleep. And in January, I had like 25 of both. Actually, my readiness was better than my sleep score. So the nutrition really does play a huge role in your sleep. And so you know that. Why is that?
Yeah. I mean, I think it's definitely an area we don't, fully understand. But when you're, having, let's say, a lot of, sugar and processed foods, and we have such a complicated, complex metabolic balance to our bodies that all of this, feeds, kind of into. And so, it's probably just and it's a vicious cycle because it alters some of the hormones, like there's a couple of them called leptin and ghrelin that
Mhm.
control appetite and hunger. And so if you look at, whether it's sleep restriction or how you eat, those things get, disrupted. And then you throw in, the insulin effect and all of that. And so all of that is disrupted by having, higher sugar, processed foods, complex, carbohydrates that may not always be the best, especially depending on the time you,
Mhm.
would eat.
Yeah.
And so that's, why, and that's interesting. I hadn't heard that much,
Oh, yeah.
detail on it
Huge.
from
Yeah.
somebody with an
Again,
aura ring.
devastating results.
yeah.
It's like, wow, we
Devastatingly
eat healthy,
positive.
we
Yeah.
sleep better. I
Yeah.
just can't believe
Yeah,
it.
yeah,
Yes, I know.
yeah.
Shockingly.
Well, and it's interesting because, like I said, it's an interesting cycle because
Mhm.
if you sleep restrict, and they've done studies on this, if you sleep restrict people, even for a night or
Yes.
two, that leptin and ghrelin balance, gets totally overthrown, and there's an increase in cravings and appetite for all the whole bad foods, high carbohydrate foods, and so forth. So yeah, so then you get more sleep, and you don't have that, and then you eat better, and yeah, it all
goes-
feeds together.
It all
It
all
does.
ties
It's all
together.
connected.
It looks like we do have a text. We have a text from Bill and Bennett. Says Dr. John Rudersdorf prescribed me a BPAP machine for my central sleep apnea back in 2014. I didn't even try to sleep without. I don't even try to sleep without it.
Mhm. I think sleep, so I do have a different question, but I think sleep apnea is one of those things too, where, like, for us, I look at that and I think I could never sleep with something on my face, but that's because I am not suffering from the sleep quality
Right.
that makes it necessary. So I definitely think that is one of those things too. Once you are getting that quality sleep, our son, when he was younger, had enlarged tonsils, but he was never sick. Like, he didn't even take an antibiotic until like right before COVID he got sick. So and he was 15. So he never got sick. So we didn't want to take his tonsils out because that was part of your immune system. And so I feel like that, kind of helped. But he had really bad, we didn't realize it, but like, he would sleep upstairs and we could stand at the bottom of the stairs and hear him breathing. He would be drenched in sweat. He would gasp when he slept, but it never affected his behavior, which, like, it does a lot of kids. I think a lot of like ADHD and stuff can be attributed to poor sleep, right?
Mhm.
Yeah.
Yes.
So it never affected that, but we actually went gluten-free with him for a while, and that helped because I think it was just an inflammatory response for him. So we did it as a family, and within 2 weeks, I realized I couldn't hear him breathing and gasping for air, and he wasn't. So
It was amazing.
It was amazing. So it was only a couple years. He grew out of it, and so we kind of reintroduced it. And then if he would start breathing in, we pull it back, and then but that's been our experience with kind of that sleep apnea. Is that what it's called with children too?
Mhm.
Yeah. And so what's the typical, like, what could we have done if I had put the two and two together?
Well, I mean, I think if you'd have taken him into a pediatrician and gave that story, and again, depending, and you're right, sometimes it's, especially in younger kids, it can be behavioral
Mhm.
stuff. But if you gave that story, they would have, and on an exam, it looked like he had big tonsils.
Yeah.
That would have been one of the first things, is to
Have those
have him see an
removed?
ear, nose, and throat.
Okay.
And have them removed.
Mhm.
That can be curative for again, in that population is apnea. Again, we use sleep apnea, which means to stop breathing. Usually in that
Mhm.
scenario, it's more of what we call a hypoventilation or hypopnea, where they're under breathing and the flow is restricted, so it's kind of disruptive to their sleep cycles and so forth. So yeah, in his age group, removing the tonsils would have been a strong consideration.
Yeah, it was never something we put the two and two together. It would just be he'd go into the doctor for his like checkup and they would note it, but he was never sick and he, didn't have any behavioral issues. He didn't have any sleep problems. He wasn't tired throughout the day. He was definitely the kid that like rarely ever fell asleep outside of his bed. So he wasn't a kid coming home from school and going to sleep. And he was not even in school. No, he was in like kindergarten maybe.
Yeah.
So that just cutting that out. And even at that point, he noticed, like, I remember one day he said, he said something, I can't remember in the way a kindergartner talks, but talking about how he wasn't, because he would stop breathing. Like you could hear it sometimes. It would be like silence. And then it would just be a huge breath. And so he noted that he wasn't being woken up by like his big breaths or whatever he said, which I thought was really interesting. But it was just a fluke that we figured that was what it was. But that was our experience with that.
We do sleep studies on children also.
Mhm.
We're accredited through the American Academy of Sleep Medicine for ages 1 year and up. And we work with Dr. Casey Berg out of Children's in Omaha. And so when the pediatricians or a primary care physician would refer a child to our sleep center, we have Dr. Berg review the notes, and then he determines whether he wants to see them or if he wants to do a sleep study to see what is going on prior to making any treatment recommendations.
Mhm.
So
Interesting.
Yeah.
So my big question that I'm afraid to ask is even more than the TV.
Well, we knew the TV was coming.
Yeah, we knew.
We
We already knew that. So my big question is sleep aids, because we talked about melatonin.
Yep.
And we do take melatonin almost daily. Is that a bad thing?
I mean, if you were going to pick a sleep aid, that's the most natural.
We used to do Benadryl, which was I think was worse, right?
Yeah, I mean, I would
It
say
has its own problems.
it has its own problems.
Yeah.
I mean, but yeah, using melatonin, there's been a lot of debate. I think when I review the literature, I'm not convinced of any long-term harm if it helps.
Okay, because I know you had talked about like your body down regulates when it comes to like caffeine and I've heard that can happen with melatonin, but you're saying that like it's iffy.
Well, yeah, I mean, I think again, anytime you're taking something exogenous, our body's funny with receptors.
Mhm.
And so, there's probably some down regulation of the melatonin receptors, but I'm not convinced there's any long-term harms in melatonin use.
Okay.
I think you probably have to be
Yeah.
cautious dosing wise. I mean, we usually will suggest less than 10 milligrams or less.
Oh, good. We do 5.
Yeah.
Okay.
3 to 5 is usually what I suggest people use if they need to.
Well,
use
and I
it.
think for us, it's more like our sleep is so important that it's like I can't leave it to chance. Like I can't leave it to chance if I'm going to be able to fall asleep. I'm generally tired, or it's that placebo effect too.
Well, because remember, I went a couple nights and didn't take any.
You did, yeah.
Last week, and I thought it was fine.
Nuh-uh, because then you took it again.
There was one night where,
yeah,
maybe I was up later because I was just like this. You get the phone and the TV on in the background. Like,
maybe.
Oh, we got this on. And
yeah,
it could be a little overstimulation
right
of my brain.
Okay,
but I did
so melatonin's okay.
Yeah, melatonin. Now, what our daughter takes Unisum.
She takes Unisom. What is your thought on that?
Well, and if I remember, Unisom I think has diphenhydramine, which is basically
Benadryl.
Benadryl.
Okay.
So,
Okay.
yeah, and
I guess I didn't look. I'll have to look.
yeah, I'm pretty sure that's what's in that.
Yeah.
But yeah, I mean, again, there can be some side effects. Probably the biggest thing with diphenhydramine regularly for sleep is that is an example of a medication that, when you're taking it initially reduces sleep latency, it's probably the biggest impact of it. But over time, it tends to lose that effect. So if you're taking it every night, it does tend to lose some of its effect. And again, dosing wise, usually we'd say no more than 50 milligrams usually.
Okay.
It's got what we call some anticholinergic effects. So it can, dry out your respiratory mucous membranes and
that's interesting
those kind of things.
Because I did have some sleep breathing, like my throat would get really dry in the middle of the night, and that's probably why now.
Could be.
Yeah.
You were taking
Benadryl.
Oh, okay.
I'd wake up and it just felt like my throat was like almost closing because it was just so dry. So that makes sense. Good to know.
Did you have another question?
I did, but I forgot it. I know.
Okay, so I have a question. So, okay,
I know.
so in the morning, this is probably a pretty common. We do this when we wake up. We have multiple alarms set. 3:10, 3:20. Does the 10 minutes do anything for us, or should we just get up? Like if we're going to get up at 3:20, just set the alarm for 3:20 and get out of bed at 3:20. Or is it just a mental thing for us? We're like, oh, we just need 10 more minutes of sleep. Is that 10 minutes doing any good, or is it just doing all harm for us?
Yeah. I mean, that's a great question. I mean, 10 extra minutes of sleep, I mean, probably isn't doing anything major. There is sometimes value in setting, or having the snooze or backup, because there's a phenomena when we first wake up. And again, a lot of it can depend on what sleep cycle we're in when we wake up, but there's what's called sleep inertia. And that's where people will oversleep. I mean, because they're in that sleep inertia. So it's that kind of that phase between wakefulness and sleep, and they subconsciously shut the alarm off or
see,
whatever.
we never do that. So I always am suspicious when people say
our members
that
will
they
say
did
that.
And I'm like, how is that possible?
That's possible. Yeah.
Okay.
Yeah. You can do it.
So we
pretty
can't
easily.
So we can't give them a hard time. And like
probably
they're
should.
supposed to be at 5 a.m. and just, I just overslept.
If it happens every once in a while. Now, if it happens all the time, then it's like you need to change some habits.
I tell them, I'd say,
okay, that's good to know.
When they tell me they tell me they'd oversleep, I would say, if there was $1,000 bill waiting for you at this gym, if you got here for 5 a.m., I don't think you would oversleep through your alarm. You would make sure you're up.
Have you ever overslept to leave on vacation? That's what I say a lot. But there's a totally different psychology to that.
Yeah.
I did remember my question.
Okay, good.
Because as my sleep has gotten better, with Whole30 and everything, my dreams are so vivid and like they feel disruptive to me because I don't wake up. I wake up and I feel like I didn't get sleep, but I think dreaming is good, right? Because it means you're hitting the stage of sleep or whatever. But what is up with that? Talk about dreams?
Yeah. Well, dreams are interesting because everybody does dream, and our predominant quote unquote dream sleep is REM sleep, and that's when our body's paralyzed and the brain is really active. So that's what generates that. But they've done studies where they've woken people up during the non-REM sleep and they can report dreams. So there's still activity that happens there. So everybody dreams, and why some people or some nights you remember the dreams. If you happen to, come out of REM sleep and have, move into a lighter, phase of sleep, then the dream can consolidate kind of into memory. And so that's what you're, appreciating. Yeah, and it is hard because some people will report, and there's even certain medications that can generate, a lot of dreamings. Like Chantix is a medicine that's used to help stop smoking in it because its mechanism, everybody will dream on that medication, and so people will report it as being, disruptive. But yeah, I mean, It's a hard one because I would say in general, it just shows, you're going through the cycles of sleep and you're moving up, into the cycle where out of REM and you're consolidating that into
Okay.
memory.
Is that something that can be affected by outside influences like sleepy, like we talked about, eating close to bed, or caffeine in the afternoon? Can that affect like your dreams too, or remembering them? Or
Yeah, I mean, it can, again, if you are altering the sleep architecture, which caffeine can do, eating
Mhm.
late can do, more likely you can have disrupted sleep. And it could go
Okay.
either way. You
Okay.
could
Yeah.
not dream because you're not having it, the activity, or you could, you know, be disrupted so much that you're
Not.
consolidating every little
Okay.
dream.
Yeah,
Um,
my dreams are annoying too because they're really mundane. But
mm,
so then I wake up and I think I've already done something because I just do things in my dreams that I do in real life.
yeah,
And so then sometimes I'm like, did I do that or did
yeah.
I dream that? So
Mm,
that can be frustrating.
it's interesting.
Or
It's really-
you're
it's-
when you're having like, sometimes I'll be having dreams that are like bad, right? Like, I can't believe this is happening. How do I get out of this? And then I think, well, I just need to wake up.
Yeah. I know.
And then
Yeah.
you wake up and you feel so good. Like,
Yeah.
I know.
That
like,
wasn't
oh,
true.
or you have a dream where you're like, you're on vacation or you're doing something and you wake up and you're like,
Man,
how do I get back to that place?
I don't ever
Yeah.
have those
Oh,
dreams.
you don't.
No.
Yeah.
But
Yeah, that's called lucid dreaming. If you're able to
that's what I told you.
re-engage,
Yeah.
and know it's a dream and
I
actively
do have those
participate.
sometimes. Yeah.
Where
I-
you're just, you like, I wake up so many times, then I fall back asleep and it's the same thing.
Mhm.
Not,
Yeah.
not, those aren't the good
Is
ones.
that real though? Or is that just how we remember it? Do
Oh, it's
you
real.
that is real that you
'Cause
can
I
like
can change
can
my dreams.
continue dreams, not lucid dreaming? I know that's real because I've had that, but is it like when you think that you've had the same, you keep having the same dream all night long? Is that just how we're remembering it? Like I thought I woke up and then went back right
Yeah.
into that dream.
No, you can have recurrent. I mean, we think.
Yeah,
I mean,
right.
it's a hard thing to study, but
Yeah.
you can have recurrent
Okay.
dreams.
Yeah.
Sometimes they're generated by our daily, like activities or stressors or those
Okay.
kind of things.
Sure.
So they can be recurrent. Yeah.
The
Interesting.
dream sleep research is really hard.
Yeah.
Mm.
Oh, I'm
and
sure.
they're doing it all the time, but it's just, I mean, we have patients that say I can dream in color, some dream in black and white.
Mhm.
When we're doing a sleep study, if they wake up out of dream sleep and have to go to the restroom, we'll say, hey, do you remember, have you been dreaming? And they'll be able to tell us what they were dreaming.
Mhm,
But
mhm,
in the morning,
mhm.
when we ask them, hey, did you dream? They'll tell us, I don't think so.
Yeah, that's
Mhm.
crazy.
Yeah.
It does fade if I don't say the dream out loud right when I would get up, I will forget it. Like, oh, I remember I dreamed something, but interesting. What about exercise at night? Could that be part of it too? Exercising close? Because sometimes I teach at night
Yeah.
a class, so maybe that's part of it. I don't know. I always like to.
Yeah, and that's
Find
another
those.
one. Exercises, obviously, as you guys know better than anybody,
Mhm.
is so important, and it definitely exercising. And again, this is probably maybe more relevant to some people than others, but in general, there can be disruptions to sleep if you're
Mhm.
exercising too close to bed. Kind of use the same thing that Cindy was talking about with eating is ideally more than 2 hours.
Yeah, and I mean, I think our nighttime, the people who work out consistently at night, their bedtime is considerably later, and their wake time is later
Later,
than ours
yeah.
is. So it could be more disruptive to us because it's not our normal.
Right.
Like, I don't exercise. I'll teach a class, but I don't really exercise for myself at night.
We're
because
more
it's too
morning.
close.
Like, if we're
Yeah.
not instructing, we'll morning is when we'll be working out.
Right.
Yeah.
Our latest class is 6 p.m. So I'll notice, like, if I teach, usually when we teach kickboxing or anything, we're taking the class also.
Mhm.
And then when I get home at 7, like, the feeling that I have teaching at 6 p.m. class is different than if I don't.
100%.
Mhm.
Like, you're
Yeah.
just more naturally awake
Mhm.
because you just got done, you got the endorphin, you're just fired up,
Yep,
right?
yep.
So it's different for me when I teach that late.
Yeah.
Yeah.
As well. So one final rain on our parade here. We're going to talk about alcohol and how that affects your sleep. So Doc, take it away.
Yeah.
Yeah, no, it's hard. Many enjoy a good nightcap. The problem with alcohol is it indeed does make us tired. It's a sedative. It can help us make us feel like we go to sleep more quickly, but as we metabolize it, it does several bad things as we're metabolizing it. It's a diuretic, so it's more likely to make us get up and use the bathroom and disrupt sleep. And then as it's metabolizing, there's a kind of a withdrawal effect that really makes, if you look, at the sleep architecture after having alcohol before bed, it will be fragmented, lighter sleep without the slow wave sleep. And often lose the REM sleep in the last half of the night, or it's markedly reduced. And so lots of, bad things that happen. And so, like Cindy said, in moderation here and there is okay, but to use it as a quote unquote sleep aid on any kind of a consistent basis, you're going to really cause a lot of problems. And like we talked about earlier, once we do that and we have inefficient and poor sleep, it just generates all kinds of downstream effects over time. So yeah, don't use it as a sleep aid. And what I usually tell patients, even if you are going to have a cocktail at night, probably okay if it's at dinner, at least in the alcohol's case, probably 3 or 4 hours before bed. But other than that, it's, best not to have it before bed.
So no shot at tequila right before I go to bed.
Probably not.
Focus
At least
on that.
if you're drowning some sorrows every once in a while.
Yeah.
that's okay,
Well, then the Huskers play a night game. It gets a little dicey.
Yeah,
So
yeah.
is that, I have a real question. So
A
is
real
that
question.
because that is also true when it comes to health, food too, because when you consume alcohol, it basically is your body prioritizing getting rid of the toxin that alcohol is. And so it will disrupt your digestion and it'll disrupt your absorption of nutrients for your food. Is that similar with sleep too? Like your body will sacrifice sleep to try to get rid of or metabolize that alcohol? Is that kind of part of how it is also?
Yeah, that's part of it.
Mhm.
But then the bigger part of it, it acts on, like I said, it's a sedative, so it acts on these GABA receptors in the brain. But then as it's withdrawing, then you get a disruption of kind of that sedative effect. And to your point, when it's metabolizing those, metabolizes into what we call acetoacetate. And so it'll, that's kind of disruptive. So it's more, I would say it's even more impactful in a detrimental way than eating.
Oh yeah. Yes.
So,
yeah. So would that be like your advice? If there was one thing that people could do to make the biggest impact, would alcohol be the thing, kind of cutting back on alcohol, try not to rely on alcohol? Would that be your number one advice?
I think it would.
Okay.
Yeah.
Good.
I think it would be number one.
Kind of pick that low hanging fruit.
Yeah.
And if you're a person drinking alcohol every night, cut that out for 30 days and see how maybe it affects your sleep.
Yeah.
And
100%.
yeah. Okay.
That and the television.
We'll see. We'll work on it.
I've been thinking this whole show, like,
We'll work on
maybe
it.
we should try that tonight.
Oh. We'll see.
Well, you
Maybe
fall
set
asleep.
your timer, the sleep timer, to 30 minutes.
Yeah.
Yeah.
Now do it don't go cold turkey,
There we go.
because that is going to really throw you into a dither.
Yeah.
So
Yeah.
That's,
Well, that's
good
how
advice.
I weaned off caffeine. I didn't go cold turkey. Went from maybe 1,000 milligrams to 600 to 400, 200
Yeah.
to none. So,
That's good.
well,
strategy.
thank you guys
That's
so
ours.
much. This
Yeah.
has been very informative. We appreciate you taking your time coming in. We'll see you guys next week on Fitness Fanatics.